Ear pain is one of the most common symptoms. It affects around 75% of children under the age of 3. Most common cause of ear pain is ear infection. Ear infection accounts around 80% of cases of ear pain. Most common symptoms of ear infection are ear pain usually affects both ear, discharge, hearing loss, fever, irritability in infants and children, feeling of fullness or pressure in the affected ear. Diagnosis is based on clinical picture, also redness, swelling of eardrum is important, you can see the picture, and this condition commonly also referred as otitis media because ear is divided in 3 parts. First is outer part, second middle part, and third is inner part. And inflammation, this middle part, is most common. That's why it is called otitis media. Most commonly it affects young children under the age 3 and more than 6 months. Treatments include antibiotics. Most common used antibiotic is amoxicillin, augmentin, also pain relievers is used. In some cases, surgery and fluid drain is also required, but it happens much rarely. Swimmer's ear is another common cause of ear pain. It accounts of 10 to 15% of cases. Swimmer's ear, also called acute external otitis. External otitis because otitis occurs external part of the ear. Symptoms include ear pain. Usually one ear is affected. Itching, discharge from the ear is also common, and feeling of fullness or blockage in the ear canal. An affected ear is tender to touch. Discharge can be clear, yellow, or bloody. It depends on nature of infection. A diagnosis usually made by symptoms. Also, such people recently exposure to water. That's important characteristics. And commonly, such people are children and young adults who spend lots of time swimming or bathing. Also, some people have naturally narrow or curving ear canals that may trap water and debris, and that's why it causes inflammation. Treatment is ear drops that contains antibiotics or antifungal agents and pain relievers. As a rule, in case of proper treatment, swimmer's ear completely recovered in 7 to 10 days, but sometimes complications can occur, and complication can be serious, and it can end it by hearing loss. Another important cause of ear pain is sinusitis. Sinusitis accounts around 5% of ear pain cases, and here in case of sinusitis, ear pain is not major symptom. It's one of the symptom among others, but it's not major. But other symptoms are, which are much more important: headache, nasal congestion, postnasal drip, and fever sometimes. Facial pain or pressure sensation on the face is also important, and yellow or green nasal discharge. Difficulty breathing through nose and decreased sense of smell or taste, also common. So, as this case, pain is not major symptom, and person will not tell you that he has major symptom ear pain. He or she has other symptoms, and among them there is ear pain. Diagnosis is made by clinical picture. Nasal congestion, postnasal drip is important, and facial pain, pressure sensation on face, sometimes fever also occurs. Treatment is antibiotics, decongestants, pain relievers, warm compresses, and nasal irrigation also helpful. Other diseases and conditions also can cause ear pain, and we will discuss some of them. Temporomandibular joint disorder, in 5% of cases it is responsible on ear pain. Earwax buildup, it's less than 5% of cases. Foreign object is rare, less than 1% of cases. Salivary gland infection, also less than 1%. Trigeminal neuralgia, also less than 1%. Also, cancer can cause, and other several conditions, but such diseases are much rare. Thank you for your interest. Thank you for your watching. If you like my channel, please subscribe. If you like my videos, please thumbs up. Thank you very much. Bye for now.